Well, and I think the most common cause of white coat hypertension is actual hypertension. I saw a statistic, something like that. More than half of people with white coat hypertension have actual hypertension. Probably was validated with the 24-hour ambulatory monitoring like you're referring to.
Yeah. A very important takeaway here is if you don't want to have high blood pressure, or if you don't want to go on a blood pressure medicine, just say that and don't let it affect, don't gaslight your doctor. Gaslight your doctor into saying your blood pressure is normal.
Anyway, what do we have? About a dozen or so things here that we think are in the dementia prevention toolkit. First one here is diet.
Yeah, it's the first pillar of health. So like anything else, you are what you eat. Some, common causes of reversible dementia are nutrient deficiencies. So like anything else, when you come in with symptoms of cognitive impairment, hopefully the patient has come in before they have overt or obvious dementia. Sometimes that is the case. And they usually come in with family if that's the case. But ideally, you'll have a lab workup. You'll be looking at nutrient deficiencies, especially in a much older population. You look at serum nutrients and intracellular nutrients if possible. And then you're looking for specific genetic dietary requirements. Let's call this nutrigenomics. And arguably, these two would just be MTHFR and ApoE, because they'd tell you basically how much do you have to watch your diet in order to improve your lipid status, and how much do you have to watch your diet to improve your methylation, B12, folate, homocysteine methionine status.
Yeah, so you can sort of take an objective look at someone's diet quality, but then the sort of surrogate endpoint you care about is, what is the blood work telling us? That's going to give you another layer of insight, because not everyone is absorbing nutrients well. Especially think of the B vitamins with a decrease in production of intrinsic factors, people increase in age. Sublingual B12 looks particularly good. We may touch on that a little bit later. And then there's exercise. So this is, again, second pillar of health, something that's very important. And it's a part of really any dementia or any health condition prevention program. You want to have regular exercise. And sort of the bare minimum you look at there is, what the AHA and these different organizations have set forth. 150 minutes of moderate activity aerobic, and then a minimum of 2 times per week strength training. Both of those things are going to contribute to BDNF, which people talk about as like fertilizer for the brain and for outgrowth and connections of neurons.
So can't you just take a supplement for that?
You can.
Where's supplements on this toolkit list?
B12.
Well, that's under diet, though.
Yeah, exercise in a pill is not here yet. And even with the mitochondrial uncouplers, I don't think that they'll fully be able to replicate that effect. I think you get that bit of hormesis from exercise, just like we talked about with the headstand push-ups. But yeah, you'll get certain aspects of the benefits. So they may have a pill for muscular hypertrophy. They may have a pill to increase your metabolic rate. But I don't think you'll be able to get one pills or even a combination of pills that's going to do the same thing that exercise does as a whole over decades.
I prefer my pills experimental, non-FDA approved, injected, and infrequent.
You're going to love bimagrumab.
Probably will. That's the myostatin inhibitor, actin, a light chain actine, I believe. But anyway, next on the list is sleep. And again, not very sexy. This is the next pillar of health. So I guess if you're looking specifically for supplements along this, we'll talk about those later. But again, these are the most powerful interventions for health, more powerful than any pill, whether it's a medication or a supplement. They're the same. One's prescribed, one's not. They both have pharmacodynamic effects. They both have pharmacokinetic effects. I'll keep saying it because it's true, because some people are so anti-medication, some people are so anti-supplement. Some types of neurodegenerative disease are essentially a sleep disorder. Parkinson's disease is arguably the progression of a REM sleep disorder, and you're very likely to have REM sleep disorder of some type. So REM is rapid eye movement. In general, other than your eyes, your body should be paralyzed during REM sleep, but your brain is working. So if you have sleep paralysis, that's where your brain is not asleep. It's awake, but you're not moving. That's the opposite of REM sleep. where a lot of times in this like pre-Parkinsonian, pre-Lewy body dementia state, the substantia nigra, the dopaminergic neurons are dying. You are asleep, but your body's not as good at shutting down the movement. So you'll see the body moving around, and generally that shouldn't happen.
Yeah, I think that's a good way to look at it. And there's a lot of overlap with Parkinson's and dementia, both being neurodegenerative, and a lot of times they get lumped together as sort of the number 3 cause of mortality being neurodegenerative conditions, even though there's specific differences between the two. But next on the list, we have blood pressure. And arguably you could say that our sort of management guidelines are a little bit lagging behind what the data show. Kind of my rule of thumb is if you're 120 over 80 or below, about 3 out of 4 times you check your blood pressure, probably in a good range, probably don't need to go on blood pressure medication. There can be exceptions there. Someone who has an existing cardiovascular disease, someone who should be on a beta blocker for one reason or another. But waiting until someone is consistently above 130 over 90, and then you tell that person, well, work on your diet, exercise, you come back in a year.
Eat more salt, do the vertical diet. Oh, wait, this is a serious podcast. This is not after hours. Yeah, in all seriousness, blood pressure is particularly important. Think of the management of stroke. If there's any healthcare providers listening or people that had a family member with stroke, is the blood pressure elevated a good thing acutely? Maybe in the management of stroke, but in the long run, you want to get that into tissue oxygen in the brain without needing to overload the blood pressure. So if you're watering a garden, you want the hose to not be clogged at the end. Otherwise, you're going to have to overload the pressure higher up in the hose. So think about what is causing the elevated blood pressure and what you can do to improve it. The average individual does not get enough magnesium or potassium in the diet. That's the theory, which is mostly correct, behind why some people can consume more electrolytes, slightly more potassium, slightly more magnesium, actually have improved blood pressure and perhaps improved kidney function. But again, you're thinking about hepatorenal syndrome, cardiorenal syndrome, and how systemic blood pressure is affected by those things. One other note on that, the gold standard for measuring blood pressure is actually ambulatory cuff monitoring. So basically a heart monitor every X number of minutes during the day and every X less number of minutes during the night. It goes off. They do this in Europe because it is much better for finding cases of things like nocturnal hypertension, which a lot of times goes with sleep apnea or nocturnal hypoxia. But they find more resistant cases of blood pressure. We don't really do that in the United States. We tried it in my residency. Everybody would just steal the blood pressure cuffs. So like you said, checking it several times at different periods of the day, that's when it's going to help. A lot of people do have white coat hypertension, but there is some people who just have stress hypertension, whether they're at the doctor or they're stressed at work or they're stressed at home. Their blood pressure is only elevated when they're stressed, but they're stressed 2/3 of the time.
Well, and I think the most common cause of white coat hypertension is actual hypertension. I saw a statistic, something like that. More than half of people with white coat hypertension have actual hypertension. Probably was validated with the 24-hour ambulatory monitoring like you're referring to.
Yeah. A very important takeaway here is if you don't want to have high blood pressure or if you don't want to go on a blood pressure medicine, just say that and don't let it affect, don't gaslight your doctor. Gaslight your doctor into saying your blood pressure is normal every other time you check it with your calibrated cuff and at the pharmacy. So, don't worry about that pre-hypertension or hypertension code. If your blood pressure is elevated, then, be okay with that and do some shared decision making. Say, I don't want to take any medications. And there's lots of other things that you can do to control it, even in addition to the DASH diet that influencers hate these days.
Yeah, there was a recent study on that. But again, how feasible is it for someone to go on 500 milligrams of sodium long term? That was basically the dose they used to show that, I think it was 80% of people about their blood pressure did drop on that. But again, 500 milligrams is a low amount, especially for anyone who's exercising.
Yeah, that is a pretty low amount of salt. I probably put that much sodium. There's got to be more sodium in just like an element or or I guess we should say a gorilla electrolyte.
Yeah, any of those are probably going to have close to a gram of sodium.
Yep.
So again, that's a tough one. But blood pressure, and again, going back to kind of the heart and the brain analogy, if you have uncontrolled blood pressure for years, that can lead to the development of congestive heart failure, which tends to have more overt, obvious signs. Like, you see your ankles start swelling up, or you lay down in your recliner and you can't breathe. Those things are going to be very obvious. Typically, these are going to be caught earlier. But if you do have someone who gets to late stage congestive heart failure, it's very similar to dementia in that they have, not great outcomes if you're looking sort of the next 5 years.
Yeah, that's why I donate blood every 2 weeks. It's always so thick after getting my hormone pellet. I figure if I do have high blood pressure, I just have so many red blood cells per volume of blood that I'm just going to have good oxygenation anyway. So I really don't need to worry about my blood pressure.
Yeah, if we put a pulse ox on you, it would probably be like 150%.
Probably. Next,
avoid head trauma. So, this, I think the best example of this has been sort of the awareness of the dangers of head injury, thinking about American football, sort of the attention that's been given to that in documentaries and different studies. This is true of really any sport or even occupation where you may encounter head trauma. Thinking of law enforcement or combat sports, football, even something like skiing is not without risk of head trauma. So basically avoid that. You don't basically use protective gear. If you're riding a bicycle, these things can, one, save your life in the short term, but also help protect your brain from the long-term effects of any trauma you might encounter.
Yeah. Our good friend, Diana Nguyen, sports dietitian, she talks about this a lot. She works with the military. She works with athletes. We've discussed DHA. We've discussed return to play protocols, and also how those might not always be perfect either, but they're a lot better than what's been done in the past. So see her page for more info on that. Yeah,
like if your quarterback gets their helmet shattered and then they just swap out the helmet and come back for the very next play without even a timeout. That's an interesting return to play protocol.
Yeah, it's only fine if it's Patrick Mahomes. He could never get injured. You just put too much money into him. So next is keeping arteries clear. So we've kind of talked about that. If you have a clogged artery, that can cause ischemic dementia. It can be big arteries. It can be small arteries. It can be embolic. It can be thrombotic. So it can be a stroke, or it can just be plaque buildup over time in small arteries.
So what's good for the heart is good for the brain once again. So managing risk factors, and this includes blood pressure, blood sugar, blood lipids, and also verifying that what you're doing is working. So we just had a whole podcast on this, talking about lean mass hyperresponders and CCTAs clearly. So I don't think we need to rehash all of that here, but just verify that what you're doing is working, because your brain or your heart may depend on it.
That's a good summary. Next is don't be diabetic. So you can't get type 3 diabetes if you don't have type 1 or 2 diabetes.
Yeah, and type 1 diabetes is often out of people's control. There's a heavy genetic component to that. It does run in families, but type 2 diabetes is almost always preventable. Like the vast majority of those cases, would not be happening with proper lifestyle interventions. Again, we don't have to go into sort of our environment and all the causes. We've talked about this sort of ad nauseum, but basically having the elevated glycemic excursions and elevated glucose levels is going to impair your blood vessels function, so the ability of the blood vessels to get blood to the brain. And you're also going to get a lot of extra oxidative stress that you don't need. And then you can get insulin resistance in the brain, and the brain is a very glucose greedy organ. It's going to use a lot of I think it's about 20% of your calories burned, or 20% of glucose is used by just the brain itself.
That's a good summary. And again, lots of discussion on this has been had in the past. This encompasses metabolic health. It encompasses metabolic treatments for mental health and cognitive function in general. So I think we've also discussed hyperbaric oxygen before, and how that might be a better therapy. Like let's find almost a perfect candidate for hyperbaric oxygen, not because they're a diver or they have burn injuries, but or gangrene, but a type 2 diabetic improved the type 2 diabetes, and is now on a low carb diet. Everything's under control. You can pre-treat with some ketones and do hyperbaric oxygen therapy. That can be a pretty potent nootropic.
Yeah. There's a lot of good data showing, and again, these kind of cost prohibitive, but again, something that hopefully as more public interest and more people are using these things, that the, safety and affordability just gets better and better. Next on the list, and maybe we could have put this at number one because it's now the number one modifiable risk factor, is obesity. And if you are obese, you have a substantially elevated risk of getting dementia.
Yep.
Again, if you're obese, you also tend to have dysregulated lipid metabolism, elevated blood pressure, insulin resistance. Sort of all these things are intertwined, and it goes back to number 1 and 2, diet and exercise. So your calories in versus your calories out.
Yep.
And now more than ever, there are more ways that you can push back against obesity, regardless of whatever predisposition you have or whatever your state you're in today. Remaining obese is not a good way to push back and try to prevent dementia.
Yeah. And of course, there'll be a devil's advocate in the comments that say the highest risk for dementia is actually individuals in their 70s or 80s who are obese and then lose weight over the next decade, which has several potential mechanisms. But that shouldn't necessarily be the takeaway. The takeaway should be improved metabolic health. If you're losing a huge amount of weight in your late 70s or 80s, you're probably losing a lot of lean body mass. And that is also a huge negative. Our friend Gabby Lyon, she always says the skin is not the largest organ in the body. It's the muscle. So keep in mind that that is going to drive your metabolic health, and that is going to be your, if you will, physical retirement account in older age that you are going to live off of.
Yeah, that's a good way to think about it. Next we have, again, I guess this overlaps a little bit with diet, avoiding excessive alcohol. So probably zero alcohol is the best. I mean, there's been the UK Biobank studies there. But the differences in like the endpoint of, let's say someone has 1 drink per month from age 30 onward. It'd be very hard to say, and the trial has never been done and never will be done. Does that actually increase the risk of dementia? So basically this comes down to, basically discussing, hey, what are the known risks? What are the known, benefits socially and staying connected to people? Those are definitely some of the confounders in the studies that show some positive effects with alcohol. Typically it's in a social setting. I mean, I can say there's probably zero benefit to drinking at home alone.
I would agree with that. And I have heard a lot of influencers say there's no benefit to alcohol whatsoever. And I understand it when they say that because they're all from California and they all do shrooms and weed there anyway. And that was a joke. Next is avoiding smoking. So, and you could put avoiding any potent vasoconstriction and any potent carcinogen in this category.
Yeah. And again, just thinks of like keeping pipes open, keeping blood flow going to the brain. Carcinogens and tobacco smoke is mainly what we're thinking of, but vaping is probably less bad, but still not something that I would say has a net brain benefit. We may talk a little bit about nicotine later on by itself, but for right now, like avoid smoking. And these rates are actually something we've been very successful with in terms of a public health intervention. Yeah.
If you're looking to get a clip out of context of one of us talking, look later in the podcast when we talk about microdose nicotine. Next is maintaining social connections. Honestly, this could be near the top 2 for a multitude of reasons. What you do as a household, you tend to do together, whether it is quitting smoking, quitting alcohol, starting exercise, starting a diet, maintaining exercise, maintaining a diet, being happy, being sad.
Yeah, I mean, the social connections, I don't think you can sort of overstate that either, because now if you look at people who have hearing loss, there's been a handful of studies over the past few years looking at hearing loss and then the risk of cognitive decline because these people are not interacting socially in the way that they were previously, and they may have a hard time understanding and carrying the conversation, and they may feel or actually be very excluded because so maybe people start treating them differently because it's like, well, they don't understand that they're hearing impaired. They think, well, grandpa's slowing down, that sort of thing. Next,
Yeah.
we have cognitive challenge in cognitive reserve. So some of this you'll see with higher socioeconomic status and higher levels of educational attainment. Those people are thought to have put their brain through more stress up front and have more cognitive reserve. But anyone can start cognitive training of sorts. When we were preparing this podcast, we made the analogy of watching TV versus playing a video game.
Mm-hmm.
I mean, watching TV is a very passive activity. It's not particularly cognitively engaging, which is what most people do for, I think the last data was like 2 to 3 hours per day. People spend watching TV.
Yeah, way too much TV. It would be reasonable to completely get rid of a TV, especially now that everything is available on demand anyway. Because if you just flip on the TV, you're not going to be working your mind. So this is where you think about, well, what can you do? You can play Scrabble, or you can help your kids or grandkids or friends with projects, or they can help you with projects. Like literally any hobby works for this. Gardening is one of them. You could do consulting work at your previous job. I know that my grandfather, that has excellent cognitive function, even well into his 90s, he frequently goes by his place of work, and he does something there, and he's smart. Perhaps he helps from time to time, but it just showing up, it gets you in that. It's so many times you see someone will retire and he or she will just decline so quickly cognitively after retiring.
Yeah, it's sort of a use it or lose it situation. And I think bringing up gardening is really interesting because sort of the avatar that I have in my mind when you think of an individual who's in their 80s or 90s or even 100s, and this person is doing really well, almost always I hear like, oh, yep, they're still doing well. They still take care of their own garden.
Yep.
I don't know why that's such a common thing, but I think that directionally, if you looked at that population, that you would see, hey, yeah, gardening is a great activity. Maybe it has to do with some of the microbiome. That's a buzzword now. And if you're getting your hands in the soil and getting a bit more microbial diversity, but really, I think it's about sort of the cognitive and tending to something, and even the social engagement with people and their plants. Some people sing to their plants.
Yeah, you're making it. You have a map of your garden in your mind. It's probably great for hypertrophy of the hippocampus, just like being an Uber driver.
Without a GPS.
Yeah. When thinking about this list, I thought, what activities am I likely to be doing when I'm going through my centenarian decathlon? I'm getting through ages 80 through 100 or 110.
Headstand push-ups.
Probably not headstand push-ups, but probably a lot of walking and hiking. Again, hypertrophy of the hippocampus, making maps, going to new places. I know there's a study that's been done with trail walking on new trails versus the same route every day, and it's certainly helpful to go on new trails. Now, obviously, that comes with the risk of getting lost, but there's ways to minimize the risk of that happening as well. Other things that I would particularly enjoy: working at a museum, giving tours somewhere, that'd be fun. Volunteering at Department of Wildlife and Parks, teaching 4-H classes, teaching gardening classes, teaching anything about animals, at least in a safe way. Volunteering at a faith-based organization or a local grassroots organization. Those are all helpful things that you can do that are arguably cheaper than buying some neural mind game that you just keep clicking on an iPad.
Yeah. One more I would add to that would be preparing for podcasts. That's something that is very cognitively engaging, and I don't see myself ever not doing that in some capacity. So insert my own bias into this list here.
I thought you were going to say playing Call of Duty.
No, it's been too many years since I've done that.
Last on this list, that was kind of a little bit of a rabbit trail discussing the cognitive challenge, cognitive reserve, is depression and mental health in general.
Yep. So taking care of mental health is just as important as taking care of physical health.